Hey everyone, and welcome. Today, we're jumping into something that is truly a game changer in the world of type 2 diabetes. There are brand new expert guidelines out, and they're completely rewriting the playbook. We're moving way beyond just thinking about blood sugar. So let's get into what this new era of care really looks like. To get a sense of just how big of a deal this is, let's start with a number. 500 million. That's about how many people around the world are living with type 2 diabetes. It's a massive health challenge, and for decades, the main strategy has been laser-focused on just one thing.
And for the longest time, the answer to that question was pretty much, yeah. The goal was simple. Get that blood sugar under control, get your HbA1c number down. But these new guidelines are forcing us to ask a really important question. Is that it? Is that the whole story? And the answer we're getting now is a very clear no.
And that really brings us to the whole point of this explainer. The mission of diabetes care is changing in a big way. So, if we're not just chasing blood sugar numbers anymore, what are we focusing on? Well, it turns out a new generation of medicines has shown us that we can, and probably should, be aiming for something so much bigger.
This right here is the heart of the entire shift. The old way was all about that number on your lab report, your HbA1c. But the new focus? It's about protecting your most important organs. The main goal now is actively preventing the heart and kidney problems that are, frankly, the biggest threats for people with diabetes. And look, this isn't just a new trend or someone's opinion. This change is driven by some really powerful new evidence. As the experts who wrote these guidelines put it, the whole focus is shifting because these new drugs have proven benefits that go way beyond just lowering sugar. They can actually shield the heart and kidneys from damage.
Another really cool thing about this is the idea of a living guideline. Think about it. This isn't some dusty textbook that's going to be out of date in 5 years. Nope. It's built to be updated constantly as new science comes out. We're actually looking at the very first version right now, but this whole approach ensures that the advice you and your doctor have is always on the cutting edge.
Okay, so if treatment isn't just about blood sugar anymore, what is it about? It's about you. It's about your specific personal risk. And this brings us to the next huge change in the game plan. We're officially moving away from a one-size-fits-all approach and into the world of truly personalized medicine.
I absolutely love this analogy. The old way of doing things was kind of like a generic one-size-fits-all t-shirt. Everybody basically got the same starting plan. The new approach, it's like getting a tailor-made suit where your treatment plan is designed to fit your unique health profile and your risks perfectly.
So, how does this whole tailoring thing work? Well, it starts by figuring out a person's individual risk. The guidelines break it down into 3 really straightforward categories: lower, moderate, or higher risk of developing serious heart or kidney issues down the road.
And here's just a quick peek at what that means. Lower risk is basically for people with 3 or fewer risk factors, things like high blood pressure or high cholesterol, and no known heart or kidney disease. But as you add more risk factors, or if a disease is already there, you move into that moderate or higher risk bucket. Getting this assessment right is the critical first step.
Okay, so once you know which risk level you're in, then what? This is where the guidelines get super practical. They lay out clear recommendations for certain medications based on that specific risk level. This is where the science really hits the road.
But wait, before we see the recommendations, we have to understand this one thing. When they say strong recommendation, it means the evidence is a slam dunk. Almost everyone in that group should get the treatment. But a weak recommendation, now that doesn't mean the drug is weak or bad, not at all. It just means the decision is a bit more personal, and it's absolutely crucial to talk with your doctor about what you want and what matters most to you.
And here it is. This table basically sums up the core recommendations for 2 major types of drugs: SGLT2 inhibitors and GLP-1 agonists. For people at lower risk, the panel weakly suggests against starting these drugs, since the benefits might not be worth it. But once you hit moderate risk, it flips to a weak recommendation in favor. And for that highest risk group, it's a strong recommendation in favor. This is that tailor-made suit we were talking about, right here in this chart. But even within those in-favor groups, there's still a choice to be made. This isn't about one drug being better overall, but which one is better for you. So, for instance, if protecting your kidneys or dealing with heart failure is the top priority, an SGLT2 inhibitor might be the way to go. If you've had a stroke or if weight management is a huge goal, then a GLP-1 agonist might be the better fit. It's all about personalizing it. And speaking of weight loss, this is such a hot topic right now that the guidelines give it its own special section. The amazing weight loss effects we're seeing from some of these newer medicines have thrown a whole new set of factors into the mix for everyone.
And here's why this is such a critical conversation. Around 90%, that's the percentage of adults with type 2 diabetes who are also overweight or have obesity. That means for most people, weight isn't some side issue. It's a central piece of the puzzle.
So the guidelines call out a newer drug, tirzepatide, specifically for this. It's recommended as an option for adults with obesity in all 3 of those risk categories. But notice that phrase again, weak recommendation. Why? Because it all comes down to that shared conversation with your doctor. Because using it involves a very specific trade-off.
And here is that crucial choice, especially for people in the higher risk group. Do you go with a GLP-1 agonist, where we have more solid long-term proof about protecting your heart and kidneys? Or do you go with tirzepatide, where the evidence is stronger for getting more significant weight loss? There is no single right answer here. It's all about deciding together what the #1 priority is.
Okay, so let's wrap this all up. What's the bottom line? What should you really take away from all this? Well, the goal of these guidelines isn't just to give new instructions to doctors. It's to empower you to be a more active partner in your own healthcare.
This one phrase shows up again and again in the document. And honestly, it's the most important takeaway of all. The whole idea is to move towards shared decision-making. The days of just being told what to do are fading. The new standard is a partnership, where your goals and what you care about are just as important as any lab result.
So if you only remember a few things, make it these 4. #1, the goal has shifted to protecting your organs. 2, your treatment should be based on your personal risk, not just your blood sugar. 3, these new drugs offer specific kinds of protection. And 4, maybe the most important, you are a key player on the decision-making team.
Which brings us to a final thought. This isn't just information to have, it's information to use. So what's the one question you could ask your doctor at your next appointment? It might be something like this. Based on my personal risk for heart and kidney problems, are we on the right plan to protect me? Asking that one question could start a whole new and potentially life-changing conversation.